So then, because we'll save your boobs for the boob section towards the end. But how many other procedures outside of your boobs have you had?
I had the butt injections that everybody was doing like 15 years ago. Mine just never went away, and I think it's also too around that same time I got sober.
Okay.
So I gained a bunch of weight, and it went lots of places. But instead of having to do a BBL, I did a fat transfer to my boobs.
Oh.
So that happened, and I also did around that same time. That's when we did another reconstruction on my boobs because I think it was this one was having complications and some deformity because of scar tissue and all different kinds of things. I've also done mid facelift. I did an upper and lower blepharoplasty.
What's that?
Eyelid.
Oh,
the upper eye and the lower eye.
Okay.
Wish I'd done that like years ago, but you don't know until you know. It was one of the easiest surgeries to recover from. They fixed the the septum in my nose because it was off to the side, and I only had, I think they said like 10% breathing capacity on my left side. And because it was crooked, it was messing with that side too, but there was more blockage on the left side.
Okay.
I also have crowns on all of my teeth. That's been a process as well. And the most recent was 10 teeth, and that was 12 hours in the dentist chair.
Oof. All at once?
Yeah. That was brutal.
Oh.
And I was talking so funny because like they had to keep on, shooting me up with the Novocaine because they kept on wearing off.
Yeah.
Oh my God, that was the worst.
I can't even imagine being at the dentist for 12 hours at once.
And the same thing with, I did a hair transplant too because I was thinning on the sides and I had like no eyebrows. So that was also another 12-hour plus day at the doctor.
Wow.
Awake. I didn't feel the nerve pain until after all the numbing wore off.
Okay.
That was intense. That was just as intense as the dentist. So out of all my surgeries, those two were the most painful because it's nerve pain.
Yeah. That's like
when your nerves are reconnecting, like that's only like a few days and it's mild.
Yeah.
And like the grand scheme of things, even with the liposuction for the fat transfer, but the teeth and the freaking hair transplant. Oh my God.
So then because some of the, people, boob jobs, butts, those are, nose jobs. Those are things that most people are aware of. And those are like the common ones. So these kind of lesser known ones, like the eyelids and the stuff like that. Is that something that, you would research for yourself, or is that something you would talk to with doctors and they might mention something to you and then you would discuss it with them?
To my knowledge, my personal experience, nobody's really talked about it unless you wanted it.
Okay.
But the doctor that did my face, I don't, it's not stalking. It's like research and development.
Okay.
But I followed him for quite some time, read up on his career and his medical background, where he went to school and stuff like that. Because I feel like a lot of people don't necessarily do like in-depth research or like see somebody on, social media and they're like, oh, I like that. But like, go to look up the Better Business Bureau. Do they have complaints? Like, are there lawsuits? Is there anything pending that's questionable?
Yeah.
A lot of people don't look at that. Like, they'll look at the price. Oh, it's too expensive. I'm going somewhere else. But even still then, if you have a complication, if you've had your procedure out of the country, can you get on an airplane and fly to said doctor when you're in the middle of an emergency? Mostly you can't.
No, you can't.
And a lot of times, doctors nearby won't touch you because it was somebody else's
patient.
work.
Yeah.
So you basically have to go to the ER and just hope for the best.
Yeah.
From people that I know that have had complications. And it's just, is it more expensive in America? For sure. But if I have to get to my doctor, it's really not, most it's going to be as a 5-hour flight.
Yeah.
Can I stomach it for 5 hours? Probably so.
Yeah.
Can I stomach it for 12? No.
Yeah. Yeah. And because you hear about people that, they go to Europe or they go to other places to get things done.
I'm sure they have great, doctors, but just like, I always think, what if something happens?
And it's like, can I fly?
Yeah.
Can I spend a day to do this?
Yeah. And is it even medically safe for me to fly with whatever possible complication could be happening?
Yeah.
That's always been my concern. Now, if I end up moving to Turkey or whatever, and I'm there for a while, like more
it's different.
It's different because I already live there.
Yeah.
But that's just been my concern. Even something as simple as teeth or a hair transplant.
Yeah.
You know, what if? Because that would be that 0.00001% of person that some weird stuff's going to happen.
Something would happen, and that you're like,
that's me. Everybody that knows me knows it.
Okay.
I'm that. Okay. Anything that can go.
Jocelyn's Law.
Yeah, anything that can go weird will.
Okay. Have you tried to, when you would get different procedures, did you try to consolidate to make sure you could go to like as few doctors as you could? Or you just went to whoever's
a specialist in that field.
The best in that?
Like my face guy, he does do other surgeries, but he's the face.
Okay.
And then Dr. Rivas does the boobs.
Yeah.
And then you got somebody else that does whatever. Like that's just my personal experience. Are there doctors that do everything great? Sure. But is it everything great that I want? Like there's a doctor in New York that does great mommy makeovers, and he also does the reverse tummy tuck, which is what I want to do. But does he do the extra large boobs? No. Can he? Sure.
But Rivas is the one who's...
Rivas is the extra large boob guy.
Yeah,
that's who I trust when I'm here.
Yeah.
Now, if I choose to go down, sure.
It's different.
Yeah.
Okay. And would you get referrals, or would you do your own research to get to find the specialists for each person?
Do my own research, but then also like, do I know anybody? And
whose work that you liked?
Exactly.
Okay.
And then do I know anybody that's seen them as a patient? And
actively?
Yes. And then everybody that I've gone to for anything, I know who they've seen, and I love the work that they've done on the people that I know, and I know the experience that they had.
Yeah.
Like, is this person hard to get in touch with? Like, not that I'm always going to have 1,000,001 questions, but what if something happens?
Yeah.
Are they easily reached? Is their staff friendly? Is everybody communicative?
Yeah.
Like, those are things that I worry about. Maybe just because I've been a mom my whole life.
No, but that's rational though, because obviously if you're used to being that kind of person where complications tend to happen or weird things tend to happen, you want to know you're covered.
Right. Even my dentist, like, doc, you good? Oh yeah, I just have a question.
Yeah. So did you think like, when you started, because was the plastic surgery a kind of a byproduct of being in the adult industry, or was it just something like, even if you were never in it, you still would have?
These are all things that I've wanted to do for myself for some time, but obviously if you don't have the funds to do things in America, you kind of got to wait and plan things out. So I've been able to plan things out around my life to where I could take the time off, and I knew that all my bills were still covered because I planned that accordingly.
Yeah.
Because a lot of people also don't think about that. Like I'm going to pay 6 months in advance of all my house stuff.
It's not just the cost of the procedures.
Exactly.
It's the cost of the
recovery. Care of the living. Then you got recovery costs, and then you got surgery costs. So add all that up, you got a good chunk of money that you need to make sure is accounted for.
Yeah.
You can't just be like, and then fuck.